Good afternoon, everyone. I'm Philip Osteen, Dean of the University of Utah College of Social Work. I'm glad you can join us for our first Social Work Beyond the Classroom presentation for this academic year. This series gives us the opportunity to highlight ways our faculty live out their commitments to the profession, to our communities, and to new ways of thinking about practice. It's one of the ways we extend the classroom into the broader world of social work, and I'm grateful you've chosen to spend this time with us, for those of you who are joining us here live and for those of you who are watching the recording later. I also would like to thank everyone who's made a donation while registering. Your generosity will directly support BSW students during their practicum placements through the Field Fund Scholarship. These gifts remove barriers and allow students to focus on what matters most, their growth as future social workers. The BSW Field Fund is a new scholarship which we awarded for the first time this past spring and has already bolstered the practicum experience of 4 of our BSW students. If this scholarship resonates with you, but you did make a donation during registration and would like to, please use the link in the chat. On behalf of our students, we deeply appreciate your support. Now, a brief note before we begin. Today's presentation is rooted in crisis counseling data and will touch on suicide risk and related issues. These conversations are critically important, but they can also be difficult. Please care for yourself in whatever way you need. Take a pause, step away, return to the recording when the timing feels right. And with that, I'm pleased to introduce Meghan Takahashi, Associate Director of our Social Research Institute and a PhD candidate in educational psychology. Professor Takahashi's experience in data science and program evaluation guides large-scale projects that make real improvements to social service systems. Her research examines how multitasking affects response times, suicide risk assessments, and client engagement in text-based crisis counseling. It's timely work with clear implications for how we design and support crisis services. Following her presentation, Professor Takahashi will have about 10 minutes to respond to audience questions. Please use the Q&A button at the bottom of your Zoom window to submit any questions that you have. And finally, I'd like to thank Dr. Jason Castillo, our Associate Dean for Faculty Affairs, who will wrap up our webinar today. And with that, Professor Takahashi, thank you for being here today. Thank you for bringing your research, and the screen is yours.
Thank you so much, Dean Osteen. I'm so pleased to be here. Let me make sure I turn on captions for the audience. All right. So hello, everyone. Thank you again for being here today. My name is Meghan Takahashi. I'm a research assistant professor and associate director at the Social Research Institute at the University of Utah College of Social Work. And as Dean Osteen mentioned, I'm also a PhD candidate in the Learning and Cognition program in educational psychology here at the U. And I'm honored to share some of my research with you all over the next hour. I'd first like to start by acknowledging that this university and the state of Utah occupy the lands of the Northwestern Shoshone, Ute, Paiute, Goshute, and Navajo nations. These lands were the traditional territory of these Native nations prior to their forced removal, and these lands continue to carry the stories of these nations and their struggles for survival and identity. As social workers, researchers, and members of our community, we are obligated to past, present, and future Indigenous communities and to hold ourselves accountable to the hopes and needs of Native American, Alaskan Native, and Indigenous peoples. Now, in light of today's discussion and September being Suicide Prevention Month, I wanted to quickly highlight some of the many university, state, and national resources available to you listed here. If you or someone you know is struggling, please reach out. A helping hand can make all of the difference. Now, while I spend a lot of my time doing child and social welfare program evaluation and research, the research I'll be presenting today explores the relationship between crisis counselor cognitive load and outcomes in text-based crisis counseling. The reason I became interested in this topic is because suicide impacts everyone. It's a complex public health concern impacting hundreds of thousands of lives each year. It's the leading cause of death among Americans aged 10 to 34, with nearly a quarter of all American youth experiencing suicidal ideation, which are thoughts of suicide. And as we've integrated technology into our lives, we've found new ways to reach people in need. Crisis hotlines and text lines are an effective resource for people in crisis, connecting distressed individuals to trained crisis counselors within seconds, allowing for real-time conversations over the phone or asynchronous text messaging where crisis counselors can respond at their earliest convenience. These modalities of care have been shown to reduce feelings of distress, with studies showing that upwards of 85% or more of texters who use these chat-based services reportedly feel that these services are helpful, and with many feeling less suicidal. This is an important finding given that individuals who use crisis chat services are more likely than other forms of care to exhibit severe mental health concerns, including higher rates of suicidality. In a recent study by Allison Lake et al. On crisis chats handled by the Lifeline Crisis Chat Network, almost half of all chats were with texters who were actively experiencing suicidal ideation, with over 80% experiencing recent ideation and 12% at imminent risk of suicide. In general, the main goals of crisis counselors are to assess texter risk and whether they are harm to themselves or others, gather critical information about the crisis to better manage the situation, respond in a timely manner, and formulate a safety plan to ensure that the person feels both cared for and has a reasonable action plan to rely on. When assessing risk, counselors should ask at minimum 3 questions to determine the texter's risk of suicide, including whether the texter is experiencing current ideation, past ideation, or has a history of prior suicide attempts. Yet crisis clients are often not asked about suicidal ideation, with one study finding that over half of all crisis chats assessed had no assessment of suicide risk, and that the rate of client dropout increased when the counselor's engagement decreased. This new modality of text-based counseling increases access to care for the general population. However, with tens of thousands of messages being sent every day, the rapid demand for text-based crisis services places a tremendous burden on crisis systems to train and support counselors that are in short supply and at risk of burnout. Crisis counselors in text-based crisis settings are often simultaneously managing multiple chats with at-risk clients, potentially increasing counselor cognitive load beyond what would be typical for in-person conversations. Now, cognitive load refers to the amount of information an individual can process in their working memory at any given time. It is the capacity limit of working memory. First introduced in 1988 by John Sweller, cognitive load theory asserts that the human brain has a limited capacity for information processing and working memory. Factors that make learning tasks unnecessarily complex or distract us from the information we're trying to pay attention to lead to an increase in an individual's cognitive load. Meaning, the higher the cognitive load, the more difficult it is to pay attention, learn, remember information, or execute tasks effectively. There are 3 primary types of cognitive load. The first being intrinsic load, which refers to the inherent complexity of the task or information itself, where more complex tasks impose a higher intrinsic load. For example, texting 3 different people in crisis at the same time while having to respond in a timely manner could impose intrinsic load, as it's a difficult, complex task. Next, we have extrinsic load, which refers to the way information is presented, which can either increase or reduce mental effort. For example, a poorly designed user interface for text-based counselors could be a distraction for counselors to effectively do their job. Lastly, we have germane load, which refers to the mental effort needed to process, understand, and create schemas or mental models to learn and solve problems. For example, the mental effort needed to build and apply mental frameworks for recognizing patterns in text or behavior or identifying risk could impose germane load. After decades of research, we know that tasks more demanding of an individual's attentional resources have higher cognitive demand and are associated with reduced working memory, impaired attention, delayed response times, increased error rates, reduced performance, increased mental fatigue. The list goes on. These effects are a result of cognitive overload, which occurs when working memory and attentional resources reach a maximum. Now, there are many factors that impact the degree of cognitive load experienced by an individual, including the difficulty of a task, time pressures, use of multimodal interfaces, working long hours or night shifts, being subjected to negative, emotionally arousing, or linguistically complex content, working in demanding, high-stress environments that require high levels of multitasking, and more. All of which are common experiences among text-based crisis counselors. Overall, delayed or inaccurate responses due to increased cognitive demand and a failure to sustain attention can increase the likelihood of catastrophic errors, especially in fields providing life-saving care, where according to the American Medical Association, almost 90% of medical errors are attributable to cognitive overload. Prior studies have shown us that therapists experience higher rates of burnout and compassion fatigue when their caseloads increase. That multimodal systems negatively affect the performance of emergency care providers, that emergency operators with high task switching demands experience higher rates of PTSD, and that air traffic controllers experience reduced memory and unsafe performance when they are unable to find cognitive relief. But text-based crisis counselors are not only experiencing all of these things, they have unique caseloads that compound these effects all at once. You see, when we think about caseload, we often think about how many clients you see in a day, a week, or a month. But for text-based crisis counselors, we're talking about caseloads by the minute. And if you think about a therapy session, you have one client sitting with one counselor having one conversation. And if a client calls into a hotline, you have one client on the phone with one counselor at one time having one conversation. But if a client texts in to a crisis chatline service, you have one client talking to one counselor who's talking to 1, 2, 3, 4, 5+ other clients, potentially at the exact same time. Each time a crisis counselor receives a text from a new client, their caseload increases, forcing them to multitask and shift attentional resources with each new text that they receive. At any given moment, a text-based crisis counselor may need to respond to one texter in crisis, then shift focus to another conversation with a different texter experiencing a different set of circumstances, and then shift again. Text-based crisis counselors must keep information from multiple ongoing chats active in their working memory while recalling crisis counseling strategies and applying them to each unique crisis in a timely manner. To illustrate this, let's say that the orange dots here are client text messages and that the teal dots are counselor text messages throughout the course of a single chat. For each of these chats, we know when messages are sent and by whom, where we can get simple metrics like response time between messages and the length of chats overall. But as I've alluded, we aren't just dealing with metrics like response times on a single chat. Chats can start and stop at any time and often overlap with each other, where, let's say in this example, the counselor may take longer to respond to the first client because a second client texts in. And then the counselor takes longer to respond to the second client because the first chat got busier. And so you might expect this sort of push and pull relationship of demand and response times between two ongoing chats. But again, we aren't just talking about counselors juggling two conversations. We're talking about counselors potentially continually juggling an unknown variable number of conversations at once, where you can imagine that over time you might start to see bigger and bigger increases in the amount of time it takes for a counselor to respond, let alone comprehend and keep up with each conversation, leading to a point of momentary burnout where the counselor maybe just isn't able to respond at all. And while this is a great example, we can actually visualize this relationship between caseload and response time with real data. Here, you are seeing a single shift of real crisis counseling chats for just one counselor. On the left axis, we have a total of 33 conversations managed by a single counselor during a single shift. On the x-axis, we have time over the course of one 12-hour shift. Now, the orange dots again represent client messages, and the teal dots represent counselor messages, where both the size of the dot and the distance between the dots here represent the response time in minutes. And if we think back to my example earlier, we can actually illustrate these concerns around caseload and response time, with each of these red boxes here highlighting instances in which the counselor took a long time to respond to a client. And if we focus on this grouping to the middle right, drawing a line through this particular moment in time, we see that the counselor is actively managing 9 separate conversations with high-risk clients, where shortly after they are no longer able to respond to 6 of the 9 actively open chats in a timely manner. And I get it, managing 2 conversations at once would be hard enough. I couldn't imagine trying to have 9 high-stress conversations all at once. But this is precisely why I'm so interested in trying to measure the effects of something like this, because we can see the real-world implications that factors related to cognitive load might have. And not just on response time, but other measures like indicators of quality and texter engagement. Today, I'll be showcasing some examples from my research on how cognitive load shapes a counselor's response time at any given moment, how it impacts whether a counselor conducts a suicide risk assessment, and how it affects the probability of texter dropout. Response time is calculated as the number of minutes between the time that a counselor receives a texter's message and the time that they respond to that message. Texter engagement includes whether the texter drops out from the chat. A texter is considered to have dropped out if they stop responding to the counselor and drop off the chat with no follow-up or indication of resolve. And this is something that we often refer to as ghosting. Quality includes whether the counselors are conducting suicide risk assessments on the chats. Again, counselors should be following the suicide risk assessment standards of the National Suicide Prevention Lifeline, asking a minimum of 3 questions about suicidality. However, I have broadened this to capture whether counselors are ever asking a texter about suicidality in any regard. Now, my research is focused on using de-identified data collected from a regional text-based crisis encounter and mobile tip line in the northern US. Clients can text into this service at any time of day for free, and within seconds are connected to a licensed or license-eligible counselor who has been trained in crisis counseling, risk assessments, and safety planning. The resulting data was collected from 2017 to 2021 and includes over 80,000 crisis counseling chats, just over 2 million messages from over 33,000 texters, serviced by about 90 counselors. Available information related to crisis chats include the date and time a message was sent or received, de-identified transcripts of the messages sent and received, as well as metadata such as the counselor's notes about the chat and more. Now, there are many possible indicators of cognitive load that we can gather from this type of data, but I'm specifically interested in understanding how caseload affects text-based crisis counselors. Caseload is determined as the number of additional co-occurring chats open from the time a counselor receives a message to the time that they respond to that message on the current chat. While message load is determined as the number of messages received from other texters on additional concurrent chats from the time a counselor receives a message to the time that they respond to that message. To illustrate what I mean by this, take, for example, the following chat. Again, the orange dots are texter messages, and the blue dots are counselor messages. Messages with a red outline indicate messages came from a counselor from a texter where they were conveying suicidal ideation. And messages with a purple outline indicate counselor messages where a counselor conducts a suicide risk assessment. What I am focusing on is the window of time between when a counselor receives a text message and when a counselor responds to that message. The texter could send multiple messages before a counselor responds, which may add to the cognitive burden in responding, but the window of time is considered from that first message, as we can kind of see here on the screen. And I'm doing this for every window of time like this on every message across every chat. To get an idea of how caseload and message load is calculated, we can focus on a single window of time and count how many other chats were open at the same time during this window, in this case 4. We can also count how many messages the counselor received from other chats during this window of time, which is also 4. Of these, we can count how many messages conveyed suicidal ideation, which is 3. And we can also count how many messages a counselor sent on other chats during this window of time, which is 2. And of these, how many were suicide risk assessments, which in this case is 1. This example can expand to even more, including high-risk messages and chats exhibiting positive or negative sentiments or emotions of, for example, anger, fear, sadness, happiness, or trust, as well as aggregating these measures on a chat level and even across a shift level. Altogether, I've got over 75 metrics on various caseloads and message loads alone. And not surprisingly, many of these overlap and are multicollinear with one another, which means that they almost perfectly explain each other. And so when it comes to modeling, only a handful of these actually make it into a final model. But the fun continues. There's many measures known to be related with cognitive load that we can additionally control for and evaluate, such as the shift number or number of shifts a counselor has worked, which we can consider as a proxy for work experience, as well as the time within a counselor shift in which a counselor manages a crisis chat. For example, whether the counselor is talking with someone in crisis 10% of the way into their shift toward the beginning of their shift, or 90% of the way into their shift toward the end of their shift. We can also look at the time of day in which a counselor manages a crisis chat, meaning the hour and minute at which a chat or message occurs, because we all know there's a difference between whether you're responding to someone at 2 p.m. versus 2 a.m. And because studies have shown that arousing linguistically complex content can increase cognitive load, linguistic measures of complexity and readability are also accounted for. Now, there are many different measures of text readability and complexity. However, studies have shown that the Flesch-Kincaid formulas are the most commonly used measures of readability within the domain of healthcare. So I've calculated the Flesch-Kincaid Reading Ease, or FKRE score, which estimates the readability of a passage of text by measuring the ratio of words to sentences and syllables to words for all messages in the data. Similarly, because studies point to arousing negative stimuli affecting the degree of cognitive load experienced, I also look at counselor and texter behaviors, which includes positive and negative sentiments, as well as emotions of trust, happiness, sadness, anger, and fear. Not surprisingly, many of these emotions and sentiments overlap with one another, and through using principal component analysis, I've since condensed these down to 2 constructs, one of positivity overall and one of negativity overall. Lastly, I look at measures of texter risk, using a tool we previously developed using natural language processing for predicting the cumulative level of texter risk throughout a chat. To give you a sneak peek as to how this risk level tool works, we built a natural language processing model, or NLP model, that broke down each texter and counselor word typed in a message into what's called a token, which assigns a numeric meaning to each word, which then allows us to attach numeric calculations to each sentence or phrase typed by the texter or counselor, which then allows us to calculate the relationship within and between written text and ultimately predict the topic of a message. We use what's called a Roberta transformer model to do this on a large scale of data, and it helps us infer what the context and topic of a message or passage of text is, and then assign a probability of risk to the message or statement based on predefined tags of high versus low risk. And what it produces is a risk score that is cumulative over the course of a chat. So as a texter becomes higher risk, the score goes up. And as a texter has lower risk, the score goes down. This lets us map the trajectory of risk over the course of a conversation, as we can see here by the blue line on our example chat. We see that the chat starts off with a texter stating that they wish to kill themselves, and the level of risk goes way up. But later the texter talks about the difficulty of growing up with homophobia, and we can see that the risk level goes down. While later it then goes back up as the texter talks about killing themselves again. So when I talk about risk scores or risk levels, I'm specifically referring to this NLP process here. And now, something I love about this example is that it not only illustrates how the level of text or risk can change throughout the course of a conversation, but that it is also an example of a texter dropping off or ghosting the chat, where at the end here, we can see that they stopped responding with no indication of resolve, which, as you've seen already, is an outcome that I'm interested in. As for my methodology, outcomes of texter dropout and suicide risk assessment are outcomes that occur at the chat level. And so many of my measures were aggregated for chat level analyses, while the outcome of response time remains at the message by message level. I, of course, look at descriptive stats for just about everything that I do. And because no two counselors have the same cognitive capacities, I utilize generalized multi-level regression models to account for within and between counselor variation. Chat level analyses are nested within counselors, while message level analyses like response time are nested within chats, which are then nested within counselors. Outcomes related to response time are modeled using gamma regression, a common method for lifetime processes. And outcomes related to whether a counselor conducts a suicide risk assessment or whether the texter drops off the chat are modeled using logistic regression because they are both yes or no outcomes. At a bird's eye view, the average counselor response time per counselor message sent was 1 minute and 45 seconds, with a median of 1 minute and 7 seconds. We also find that texters drop out from the chat just over 31% of the time, and that suicidal ideation was conveyed by texters on just over 36% of chats, with only 12.5% of chats having any suicide risk assessment. Now, from the time that a counselor receives a message to the time that they respond to that message, the average caseload is 1 to 2 chats, usually in the range of 0 to 5, and in rare cases, up to 15. The average message load from other chats is 0 to 1, often in the range of 0 to 10, and in very rare cases, up to 101. The average number of messages received on the current chat is usually 1 to 2, often in the range of 1 to 5, and in very rare cases, up to 77. The average number of messages sent by the counselor on other chats is 0 to 1, usually in the range of 0 to 5, and in very rare cases, up to 79. The average suicidal ideation message load from other chats is usually 0, sometimes 1 or 2, and in very rare cases, up to 13. And lastly, the average suicide risk assessment caseload is usually 0, sometimes 1 or 2, and in rare cases, up to 5. We also see that from the time a counselor receives a message to the time that they respond to that message, the risk level among texters tends to be either fairly low or fairly high, and that their average FKRE score among texters is around 87, which indicates easier to read text, usually around a 6th grade level. We also see that the average texter word count is about 15 to 16 words per message, usually in the range of 1 to 25, and in very, very rare cases, up to more than 2,800 words. I feel for the counselor that managed that chat. And texters tend to be more negative with their language compared to counselors who tend to be a little bit more positive. And texters also convey higher degrees of sadness, interestingly followed by trust. Lastly, clients typically text into the service between the hours of 10 p.m. and 3 a.m., so there's a lot more demand that we see happening during the night shift than during the day shift. When we look at what of these impact counselor response time, we find that for every additional chat a counselor manages, the counselor response time increases by 7.3%, or about 7.5 seconds. This means that if a counselor had an additional caseload of 3, I'm just kind of arbitrarily picking the number 3 here, that their average response time would increase by about 24 seconds. We also find that for every additional chat managed that requires a suicide risk assessment, the response time on the current chat increases by 19.6%, or about 36 seconds per message sent by the counselor. And we also see that for every additional suicidal ideation message received on a different co-occurring chat, the counselor's response time increases by about 44.5%, or about 1 minute and 22 seconds. These findings, I think, make intuitive sense, as we might expect that a counselor's response time would suffer as their attention is drawn away from the chat. And we can also see how demand on the current chat impacts their response time, such as more or longer messages to respond to, leading to longer response times, or conducting a suicide risk assessment leading to shorter response times, presumably as their attention focuses on the current chat. But we also find many of the indicators known to be associated with cognitive load to also have an intuitive impact on response time, such as counselors responding faster to easier to read messages or having more work experience. And we can also see that higher levels of risk or texter negativity lead to longer response times, and that the longer a chat is open, the longer it takes a counselor to respond, potentially pointing to some sort of mechanism like momentary burnout. To illustrate what these effects look like, we can plot the marginal predicted probability of how something like caseload impacts response time. So you can see here that as caseload increases, the response time is also increasing. But while a 5.5-minute average response time at a caseload of 15 is alarming, the majority of the time we see fewer than 5 additional cases managed. And this is something that we should consider when interpreting our findings and making recommendations. We can also see how the effect of suicidal ideation message loads impact response time. But again, keeping in mind that few counselors experience suicidal ideation message loads above 2. Lastly, we can see how the predicted response time changes as suicide risk assessment caseloads increase. But again, the impacts are typically seen in the range of 0 to 2 additional chats with a suicide risk assessment being conducted. When we consider what impacts texter dropout, we find that an increase in the interaction between caseload and/or the peak message load on a chat increases the odds that the texter drops out from the chat by about 3%. This means that if a counselor had an additional caseload or message load interaction of 3, which could be 3 chats and no messages, or 1 chat and 3 messages, the odds that the current texter drops out from the chat would increase by about 9.3%. So this can get rather large rather quickly. We also find that when the number of additional chats requiring a suicide risk assessment increases, the odds that the texter drops out from the current chat increases by 7.4%. Now, the true mechanism behind how increasing caseloads is related to the increased odds that a texter will drop off from the chat is not entirely known, but may be related to response time in some fashion, and that requires further evaluation, something that I intend to look at further. But again, we see some positive findings from this analysis, such as suicidal texters and texters who receive a suicide risk assessment having lower odds of dropping off from the chat, which I think emphasizes the importance of counselors conducting suicide risk assessments. We also see some less intuitive findings, such as easier to read counselor messages being associated with an increased odds of a texter dropping off, yet more positive counselor language leading to a reduction in the odds. Before conclusions can be drawn from these types of results, further evaluation is needed regarding the content and composition of what these messages look like, especially for messages with higher or lower FKRE or positivity scores, because right now we just can't say what exactly is happening here. And again, while we may see large effects at high interactions of caseloads and message loads, the majority of the time we see fewer than 5 additional cases managed or 5 additional message loads that the counselor has to respond to. And for the increasing probability of texter dropout based on increasing suicide risk assessment caseloads, we rarely see effects above a suicide risk assessment caseload of 2. Lastly, when we consider what impacts whether a counselor conducts a suicide risk assessment, we find that for every additional chat a counselor manages during the chat, the odds a counselor conducts a suicide risk assessment on the current chat reduces by 4.3%. This means that if a counselor had an additional caseload of 3, the odds that they conduct a suicide risk assessment decreases by 12.4%. In contrast, we find that when the number of additional chats requiring a suicide risk assessment increases, that a counselor is actually more likely to conduct a suicide risk assessment on the current chat by about 6.7%, suggesting that once a counselor is conducting an assessment for one texter, that it might promote them to carry that over to other chats that they are co-managing at that time. And I think, again, emphasizes the importance of conducting suicide risk assessments. Intuitively, counselors are way more likely to conduct a suicide risk assessment on the chat if the texter conveys suicidal ideation, has a higher level of risk, or conveys a higher degree of negativity, something that we would hope to see. But as a counselor is flooded with more and more messages and longer messages on the current chat, they become less likely to conduct a suicide risk assessment, possibly a reflection of overload and an inability to process information effectively in the moment. Interestingly, we find that counselors are more likely to conduct a suicide risk assessment when the texter's messages are easier to read. And while this warrants further investigation, it aligns with prior literature suggesting that linguistically complex information can impair cognitive functioning. As we visualize the relationship between caseload and the predicted probability of a counselor conducting a suicide risk assessment, we see the significant impacts of reduced suicide risk assessments for the majority of our chats and texters, though luckily a substantial reduction at very high caseloads isn't happening very often. Now, a quick note about within and between counselor effects is that counselor response times vary both within and between counselors, with about 16% of the variability explained by differences between chats within the same counselor, and another 15% by differences across counselors. Similarly, about 19% of the variability in texter dropout and 9% of the variability in suicide risk assessments is attributable to differences between counselors, pointing to meaningful counselor level differences across all 3 outcomes that should be further assessed because we can't really say what's going on between counselors quite yet. So to summarize, response times increase when the number of suicidal ideation messages received on other chats increase, the texters are more negative or their risk levels increase, the counselor has more messages or longer messages to respond to, overall caseloads and suicide risk assessment caseloads increase, and the longer that a chat is open. We also find that response times decrease when a counselor conducts a suicide risk assessment on the current chat. When a texter's messages are easier to read, the more experience a counselor has, and when chats occur later at night. We find that for the odds of texter dropout, the odds increase when suicide risk assessment caseloads increase, or the interaction of caseload and message loads increase. When the counselor's messages are easier to read, the longer a chat is open, the more experience a counselor has, and when chats occur later at night. We also find that the odds of texter dropout decreases when the more positive a counselor's messages are, when counselors conduct suicide risk assessments or when the texter conveys suicidal ideation, and when the more readable the texter's messages are and the longer a counselor has been working in their shift. Lastly, the odds a counselor conducts suicide risk assessments increases when the texter conveys suicidal ideation, strong negativity, or higher risk levels. We also see this when suicide risk assessment caseloads increase, the longer a chat is open, the more experience a counselor has, and the more readable the counselor's messages are, which may or may not be a result of clearer language used when conducting a suicide risk assessment and is something that I plan to evaluate further. We also find that the odds a counselor conducts a suicide risk assessment decreases when the counselor has more messages or longer messages to respond to, when counselor response times or caseloads increase, and when chats occur later at night. These findings have important practice implications. Higher caseloads result in slower response times, increased texter dropout, and reduced suicide risk assessments, especially when these caseloads involve high-risk texters. This mirrors prior study findings highlighting how multitasking demands reduce timely, quality care. Chat platforms should seek to monitor and cap concurrent caseloads more carefully and possibly establish a maximum caseload limit. In my own opinion, the upper limit should be set at 5, ideally no more than 3, and even less if the counselor has multiple high-risk chats happening at the same time. With the rapid expansion of AI and large language modeling, it's also worth considering implementing a triage system that monitors acuity and content in real time and assigns high acuity texters to counselors with lower caseloads, and ideally would help limit competing high acuity caseloads for counselors. These AI systems can also embed real-time alert systems that can flag a supervisor when a counselor has reached max capacity, and can serve as a training and supportive tool for counselors to help prompt them, such as with nudges or pop-ups, when a counselor conveys a higher level of risk or suicidality that would warrant a suicide risk assessment or further inquiry from the counselor. Which I think further emphasizes the importance of training counselors on how to manage higher caseloads, to routinely conduct suicide risk assessments, and to balance the use of positive plain language with risk assessments, safety planning, and crisis management. Additional training, such as role-play scenarios with higher caseloads, as well as long and complex or highly negative messages, should also be emphasized for text-based crisis counselors in helping them maintain clarity and responsiveness. In addition to implementing a cap on caseloads, organizational policies and practices should be considered, such as the level of support provided to aid in cognitive relief, like frequent breaks or shift rotations, as well as staffing capacities, ensuring agencies are adequately staffed to reduce the likelihood of counselors having to take on higher caseloads. As for future research, these findings pose more questions than they do answers, in my opinion, such as how texter and counselor use of language impacts outcomes. We see varying effects of sentiments and emotions, as well as the readability of text on outcomes. And more research is needed to determine what the mechanisms of effect are with each of these, and how this is reflected in real-world data. It's also crucial that we gather feedback directly from text-based crisis counselors themselves on their experiences and perceptions of caseload management, use of chat platforms, the barriers they face to providing quality care, and recommendations they may have for improvement. Additionally, the implementation of AI-driven monitoring and alert systems would require careful development and integration, ensuring their accuracy and precision over time, as well as their utility as an assistive tool. Now, there are a few limitations that require further research as well. The data collected only spans 2017 to 2021, and the longitudinal impact of these outcomes should be evaluated on newer, more recent data to see whether these trends persist and how organizational and legislative changes impact outcomes over time. Lastly, the data collected, unfortunately, cannot tell us about counselor and texter demographics, such as age, gender, race, ethnicity, location, or financial status. We saw how 9 to 19% of the variation in outcomes was attributable to differences between counselors. But these differences are unknown and emphasize the importance of both training and support for counselors for consistency in service delivery, as well as the importance of evaluating how unique counselor traits, such as prior experience, training, personality, and coping, can impact a counselor's ability to succeed. And because we don't have any demographic data for the texters, future research should examine how disparities and systemic inequities impact service delivery and response to treatment in a text-based environment. Now, I do want to be careful here because I am not suggesting that text-based crisis services are not effective and should not be utilized. There's myriad research demonstrating their effectiveness in reducing distress and suicidality. But what I am suggesting is that we can make improvements to a relatively new system of care and ensure that it's tailored to meet the needs not only of those seeking crisis services, but also to those providing crisis services. And there's about a million billion more things that I could probably say about this topic of research. But the last thing that I will say is thank you. Thank you to my colleagues, Zach Immel, Brent Caius, Vivek Srikumar, and many others for their contributions to this work. And thank you for your time today with me as we shed some light on a new era of mental health services and delivery of care and how we can think through building a better tomorrow. If you have any questions, comments, concerns, hopes, dreams, wishes, I would love to hear them. And you can also reach me at any time at my email posted here on the slide. Thank you. Let me take a look at the chat if there's any questions here. So I don't see any questions yet, but if anyone has anything they'd like to ask, I'm more than happy to talk. And again, you can always reach out to me at my email as well. Oh, the Q&A area. Where do I see the Q&A area? Just a moment. Oh, there it is. Okay. Let me see here. Okay, so we have a question. What do you think could be a solution for crisis chat counselors not doing suicide risk assessments despite clients expressing ideation? And do you think it would be possible to have scripts of risk assessments tailored for common messages from clients expressing suicide ideation to lessen the response times? I'm going to answer your last question first, and that is yes. I do think that there can be some scripts implemented or readily available to counselors to quickly paste into the chat that gets the conversation started for conducting a suicide risk assessment. Now, that's not something that I think would work for every situation, as the conversation may change and would have to be adapted uniquely to each client that they're talking with. But I do think that that is a worthwhile solution. And as far as your first question of what's a solution for counselors not conducting suicide risk assessments, training. I think it needs more training. I think from what we've seen so far, suicide is a really difficult conversation, even for trained counselors to engage in. And I think it takes a lot of training to become comfortable with asking people about suicide and asking directly about suicide. I'm going to go to another question here. So another anonymous poster says, I'm fascinated by the finding odds of texter dropout increasing when the counselor has more experience. Any idea why this might be? Great question. And I don't, not yet. I could hypothesize in the moment that perhaps the more experience a counselor has, the better they are at engaging the clients that text in the moment. But that would just be off the top of my head. It's something that my colleagues and I are also fascinated by and plan to look at further. There's another question here about, is there a general guideline for how much time counselors should spend with each texter, or does it depend on the situation? I would say that it depends on the situation. There is no general guideline that I'm aware of for how long messages or text messages should be. Some chats go on for hours, and in some cases, clients have requested that a counselor keep a chat open overnight so that as they fall asleep, they can wake up and continue the conversation. And so it really just depends on the needs of the client, where they're at, and how they're feeling. I have a question here about what technology is used for texting. Great question. So my understanding is it's a digital chat platform where a counselor can sit down at a computer with multiple screens available to then provide text messaging services over that platform. We've got another question here asking, do counselors typically have a set caseload during each shift? The answer, I think, is largely no. But it depends on the platform. There are some platforms that have set an upper limit already on caseloads. I'm forgetting which one has set an upper limit of 3, but not all platforms have set that. And so it really just depends on the chat service that you're texting into. Let me see here. We have another question of how are crisis counselors not doing suicide risk assessments on every single person who calls or texts in? This is a great question, and it was a question I had as well. But as I dove into the data, I can see how there are times where counselors may forget. For example, you may have a texter texting in asking what they should wear to work that day. And while I do think that every person who texts into a crisis service does deserve to have a suicide risk assessment conducted, when you have a multitude of cases happening at once, I think these lower acuity conversations that get started and kind of end and fizzle out may not be on a counselor's radar to conduct a suicide risk assessment. And so while that's not a great excuse, there are some differences that are happening that way. Let's see here. Was there any separation or differentiation before 2020 and during or after 2020 and how the pandemic affected these results? That's a really great question and is not something I've looked at longitudinally yet, but is something that I should definitely look into. So thank you for bringing that to my attention. We have another question here. So as someone who is unfamiliar with text-based crisis counseling, are outcomes such as whether someone ends up in the ER due to a suicide attempt, formally tracked, death by suicide, or if they follow up with a therapist? I'm going to say it depends on the system, but in most cases, probably not. Very rarely do we see systems that have continuity of care between different platforms where services are provided. And so if you text into an independent service provider who then contacts an ambulance or mobile crisis outreach team to go and service that client, there may not be follow-up directly on what happens with that client afterward. I would love to see systems start integrating data together that way, but we're just not quite there yet. We've got another question here, and I'll probably just take a couple more questions and then hand it over to Jason Castillo to wrap up. But this question, a friend mentioned they knew someone who was using ChatGPT for counseling. Not ideal, but better than nothing. Am I aware of steps to get AI platforms to direct that type of inquiry to real crisis counselors or behavioral health professionals? I am not. I think that's a great step in the right direction for platforms like ChatGPT or other open language models to direct clients to services. I do believe that in some cases, a service like ChatGPT will provide general information such as hotlines to reach out to, but I don't think there's a formal process in place. Jason, do I have time for more questions or should I wrap up?
Professor Takahashi, one final question, and this is in the webinar chat. In your research, did you see any evaluation of the crisis counselor's own mental health? This would be connected to their own mental capacity and safety.
We do not. I think that would be fascinating data to look at and see how that intersects with a lot of these outcomes. But unfortunately, information related to the crisis counselors themselves is highly protected and not available to us.
All right. And that question came from Julio Jarvis, so thank you for the question. Professor Takahashi, thank you so much for today and for sharing this important work. Your research gives us a clear picture of how crisis counselors' capacity directly shapes the care people receive in their most vulnerable moments. It's a powerful reminder of why supporting those on the front lines matters so deeply, and fascinating to think about how AI might be able to help crisis counselors better prioritize their communications. I also want to thank everyone who joined us today. For those seeking continuing education credit, this session has been approved for 1 suicide prevention CEU. Please watch your email in the upcoming days for links to the recording and CEU quiz, or check our events page. Once you've successfully completed the quiz, your CEU documentation will be automatically emailed to you. We hope you'll also join us for our next Beyond the Classroom event, happening next Thursday, October 2nd. Professor Yvette Romero Coronado will share insights into building better, more culturally responsive immigrant and Latin mental health practices. It promises to be another meaningful discussion, and I hope you can make it. You can find details about all of our events on the college events webpage at socialwork.utah.edu/events. Until then, thank you again for being with us today. Take care.
Thank you.